All right, ready to dive into the world of nursing. We're going to unpack some fundamentals perfect for anyone starting out in a fundamental nursing course. So if someone cornered you at a party and asked, what do nurses actually do?
Hmm.
How would you even answer that?
It's trickier than it sounds, right?
Yeah.
Because nursing, well, it's so much more than just, taking temperatures and giving out meds. And the excerpts we've got here, they really showcase the incredible range of what nurses do.
It's amazing when you think about it.
I mean, there are nurses out there training to administer anesthesia, responding to emergencies on ambulance crews.
Right.
They're even doing research, groundbreaking research on the ethical dilemmas in nursing.
It really highlights how nursing isn't just about bedside care. It's also about promoting health, preventing illness, being a powerful advocate for your patients, and even shaping healthcare policies on a bigger level.
Yeah, it's a much broader field than most people realize.
Absolutely. Nursing, it's about understanding and caring for the whole person, their physical needs, their emotional needs, their social needs, even spiritual needs. Speaking of history, I was reading that, get this, in ancient civilizations, people believed that illness was caused by evil spirits.
Crazy ass.
Yeah.
So let's go back in time for a sec. Let's trace how nursing evolved from those ancient beliefs to the birth of modern nursing with Florence Nightingale.
Well, it's definitely a fascinating journey. In early civilizations, caregiving was deeply intertwined with spiritual beliefs and practices. But then, during the early Christian period, we see this emergence of a more formalized role for nurses, particularly within religious orders. However, the real turning point, the real game changer, that was Florence Nightingale.
Oh, yeah, definitely.
Her work during the Crimean War revolutionized the profession. She emphasized sanitation, proper training, and just this incredible focus on the patient's overall well-being.
I actually read that she was a stickler for record keeping, meticulously tracking patient outcomes, advocating for better conditions, basically laying the foundation for evidence-based practice. That's a great point. It's those small details that often get overlooked, but they really had a huge impact on shaping nursing into the respected profession it is today.
So let's fast forward to today. It seems like everything Florence Nightingale fought for is still incredibly relevant. The excerpts lay out these 4 key aims that guide nursing practice: promoting health, preventing illness, restoring health, and facilitating coping with disability or death. But it's not just about knowing those aims, it's about how nurses actually put them into practice. Let's say you have a patient who just refuses to make lifestyle changes, even though they're at a very high risk for heart disease. How do you approach a situation like that as a nurse?
Well, that's where the real art of nursing comes in. It's not just about lecturing a patient about, healthy habits. You have to really understand their perspective, their fears, their motivations, what's holding them back. It takes a combination of knowledge, empathy, and really strong communication skills to guide them towards making healthier choices.
It sounds like nursing requires this balance of knowledge, compassion, and advocacy. It's not just a job, it's a profession with its own values and responsibilities.
Exactly. And speaking of professionalism, nursing isn't just about what you do at the bedside. It's also about being part of this larger professional community. Organizations like the American Nurses Association, ANA, and the National League for Nurses, NLN, they play a crucial role in setting standards, advocating for nurses' rights, and providing resources for continuing education. It's about the advancement of the nursing profession as a whole.
Makes sense. And there must be a whole legal side to nursing as well, right? I mean, you're dealing with people's lives and well-being. There have to be rules in place to ensure everything is done safely and ethically.
Absolutely. Each state has its own set of laws called Nurse Practice Acts. They define what nurses can and can't do, their scope of practice. It's all about protecting the public, ensuring that only qualified individuals are providing care, and upholding those ethical standards.
So it's like a legal framework that helps nurses navigate all the complexities. I bet those nurse practice acts come in handy when nurses find themselves in tough situations or have to make difficult decisions.
Oh, absolutely. Sometimes a nurse might be asked to do something that falls outside of their scope of practice, or they might encounter a situation where they have to speak up, advocate for their patient's safety. Understanding those legal boundaries is essential.
Wow. We've gone from ancient rituals to modern healthcare regulations in just a few minutes.
And we've only just scratched the surface, but it just highlights how much nursing has evolved and the huge responsibility that comes with this profession.
So we've talked about what nursing is, its history, and the professional frameworks surrounding it. But what about the future? Healthcare is constantly changing, with new technologies, new challenges emerging all the time.
That's a great point. The nursing profession, it's in this constant state of flux, responding to advancements in medicine, shifts in demographics, and of course, health crises. We're seeing trends like nursing shortages, the expanding role of technology like telehealth, and there's an increasing emphasis on interprofessional collaboration.
So how do aspiring nurses prepare for all this? It seems like they need more than just textbook knowledge to really succeed in such a dynamic field.
You're absolutely right. Nursing education is adapting to equip nurses with the skills they need to thrive in the 21st century. There's a bigger focus on things like critical thinking, problem solving, cultural competence, and leadership skills. Reports like the Institute of Medicine's Future of Nursing emphasize the need for nurses to, practice to their full potential, pursue higher levels of training, and become true leaders in shaping healthcare.
It's amazing to think about the impact nurses can have, not just at the bedside, but on a much larger scale. So in this first part of our deep dive, we've explored the history of nursing, the diverse roles that nurses play, the professional framework, and even got a glimpse into the future.
It is just the beginning, though. In the next part, we'll shift gears and focus on those essential competencies that form the foundation for safe and effective nursing practice, the QSEN competencies.
Also sound important.
Things like patient-centered care, teamwork and collaboration, quality improvement, safety, evidence-based practice, and informatics. These are like the building blocks for providing excellent nursing care.
That sounds like a great place to pick up next time.
Welcome back to our deep dive, ready to explore those QSEN competencies.
Definitely. They sound super important, but to be honest, sometimes all those nursing acronyms can make my head spin a little. Can we break them down, in a way that makes sense for someone who's maybe just starting out in nursing school?
Of course, of course. Let's start with patient-centered care. Now, it might sound obvious, but it's really about putting the patient at the heart of everything a nurse does.
So it's more than just being nice, being friendly.
It really is. It's about recognizing that each patient is an individual, not just a diagnosis, a name on a chart. You need to understand their unique needs, their preferences, their values, their backgrounds.
So like if one patient really values their independence and another really wants a lot of support from their family, you'd approach their care differently.
Exactly. It's about respecting their autonomy, involving them in decisions about their own care. It's a partnership, not a dictatorship.
That makes a lot of sense. Okay, what about teamwork and collaboration? Healthcare involves so many different professionals, but why is teamwork so important in nursing specifically?
Well, think about it. In a hospital setting, you've got doctors, nurses, pharmacists, therapists, social workers, all working with the same patient. Teamwork and collaboration, they're essential to make sure that care is coordinated, seamless, and most importantly, safe.
Right. You don't want anything falling through the cracks just because people aren't communicating or working together effectively. But teamwork can be tricky, can't it?
Oh, absolutely. Especially when you have, different personalities, different opinions, different communication styles.
Right.
So it's really about developing those communication skills, being able to voice your concerns respectfully and knowing how to resolve conflicts constructively.
So it's not just about getting along, it's about being an effective advocate for your patients, even within a team environment. Okay, on to the next one. Quality improvement. Is that just a fancy way of saying making things better?
Well, it is about making things better, but it's also about having a really systematic approach to improvement. It's about using data to see, okay, where can care be enhanced? What solutions can we come up with? And then you put those changes into action and then you track the results. Are these changes actually leading to better outcomes for patients?
So it's a cycle of constantly evaluating and improving. Like a science experiment, but for patient care.
Exactly.
And it must get overwhelming at times, right?
It can be a lot to juggle, for sure. But quality improvement shouldn't feel like this extra burden. It's really about having that mindset of continuous learning and improvement, always looking for those ways to enhance your practice and provide the best possible care.
It's about never settling for good enough.
Yeah.
Okay, now, safety. It seems like safety should just be a given in healthcare. So why is it highlighted as its own separate competency?
Well, because even with the best intentions, mistakes can happen. The safety competency, it's about creating a culture of safety where those potential risks are identified and addressed proactively. It's about being vigilant, paying attention to those seemingly small details and always thinking 2 steps ahead.
So things like double-checking medications, making sure a patient's environment is safe.
Yeah.
Are there fall risks? And speaking up, if something seems off.
Absolutely. It's about being that extra set of eyes and ears for your patients.
That makes a lot of sense. Okay, evidence-based practice, what does that even mean?
It sounds kind of technical, but it's a pretty simple concept. It's making sure that your clinical decisions are grounded in the best available evidence.
So not just doing things because, well, that's how we've always done it. It's about staying updated on the latest research, incorporating that knowledge into your practice.
Exactly. You combine the research with your clinical expertise and the individual patient's needs and preferences.
Gotcha. Last but not least, informatics. Technology is taking over everything, so this one feels super relevant. But how does it actually apply to nursing?
Well, informatics and nursing, it's all about utilizing technology to enhance patient care. So, it's about using electronic health records effectively and efficiently, understanding telehealth technologies, and just being able to navigate all that health data.
So nurses need to be tech savvy. Who knew?
In this day and age, it's essential. It's not just about bedside manner anymore. It's about those keyboard skills, too.
I guess so.
But don't worry, bedside manner is still extremely important. But nurses need to be comfortable using technology to communicate, document, and access information safely and effectively.
It's all about leveraging those digital tools to really benefit patients.
Yeah.
These QSEN competencies cover a lot of ground. It's clear why they're so essential, for preparing nurses to handle everything that comes with modern healthcare.
And they're not just, boxes to check off. They're really a framework for thinking about nursing practice in a holistic, proactive way. So as you move through nursing school and into your career, keep these competencies in mind.
It's a lot to take in. But I feel like I have a much better understanding of what it actually takes to be a skilled and competent nurse in today's world. But something tells me there's still more to uncover, right? Welcome back. We've explored the kind of the heart of nursing, the roles, the skills, the competencies. Now in this final part, we're getting into the legal and ethical stuff. It's like the rule book and the moral compass for nurses.
Yeah, great way to put it. We're talking about the framework that makes sure nursing care isn't just competent, but also ethical and legally sound.
Okay, so first up, we've got these things called Nurse Practice Acts. They sound pretty serious. What are they all about?
So think of Nurse Practice Acts as the legal blueprint for nursing practice. They outline what nurses can and can't do, essentially defining their scope of practice. It's all about public safety, making sure that only qualified people are providing care.
So it's not like a universal set of rules, right? Like each state has its own.
Exactly. What a nurse is allowed to do in one state might be different in another state. That's why it's so important for nurses to be familiar with their state's specific Nurse Practice Act.
So it's like knowing the rules of the road before you start driving. But what happens when things get a little bit murky? What if there's no clear-cut answer in those legal guidelines?
Well, that's where the Code of Ethics for Nurses comes in. It offers guidance for those trickier situations. It emphasizes things like respecting patient autonomy, acting with integrity, prioritizing patient well-being.
So it's like a moral compass for nurses.
Exactly. It's a resource that nurses can turn to when facing those ethical dilemmas.
I'm starting to see how the legal guidelines and the ethical principles all work together. It's like having a map and a compass, making sure nurses are heading in the right direction, both legally and ethically.
Yeah.
But what about a nurse's own personal values? Where do those fit in?
Those personal values, they're the foundation, the driving force behind everything. The excerpts actually highlight several key values for nurses: altruism, autonomy, human dignity, integrity, and social justice.
Okay, can we unpack those a bit?
Yeah.
Altruism, that's about putting the patient first.
Yeah.
Right? Like going above and beyond, even when it's tough.
Yes, exactly. It's that selfless concern for the well-being of others.
Okay, and autonomy.
Autonomy, remember, that's all about respecting the patient's right to make their own choices about their health care.
Even if those choices aren't what the nurse would recommend. I mean, that seems like it could be really challenging sometimes.
It definitely can be, but respecting autonomy is absolutely fundamental to ethical nursing practice.
And human dignity.
Human dignity. That's about recognizing the inherent worth and value of every single person, regardless of their health status, their background, their circumstances.
So treating everyone with compassion and respect no matter what.
Okay, what about integrity? Integrity is about honesty, ethical conduct, and being accountable for your actions. It's about doing the right thing, even when it's hard.
And finally, Social justice.
Social justice. That's about striving for fairness and equity in healthcare, advocating for those who might be marginalized or face barriers to care.
So it's like being a voice for the voiceless. Wow, these values, they're powerful.
They really are. They're not just words. They're the guiding principles for ethical and compassionate nursing practice. As you continue your journey in nursing, let these values shape your actions, your interactions with patients, with colleagues, with everyone.
This duck dive has been an amazing journey. We've gone from ancient beliefs about illness to the complex, I guess, legal and ethical realities of nursing today. And I feel like I've learned so much about what it truly means to be a nurse.
It's a profession that's filled with challenges, but also incredible rewards. So as you move forward, never stop learning, never stop growing, and never stop advocating for your patients.
And for the future of nursing.
We hope this deep dive has inspired you and giving you the knowledge and insights you need to thrive in this amazing field.
Until next time, keep learning, keep caring.